Next, we have gastrointestinal inflammation. Gastrointestinal inflammation. So we'll start with gastritis, which is inflammation of the stomach, and gastritis can either be acute or chronic. Acute is self-limited, which means it goes away on its own. It doesn't last very long. This can also be associated with an ulceration of the stomach, so a bleeding or unbleeding, just open sore. And the most common cause of acute gastritis is taking an NSAID every day. So that could be aspirin, naproxen, which is Aleve, ibuprofen, which is Motrin or Advil. So really anything that's blocking the COX-1 enzyme can cause acute gastritis. This can also be caused by alcohol. So the stronger the alcohol, the higher the proof. And if it's not drunk with anything else, like a mixer, or even like wine has like grape juice in it too, the the stronger it is, the higher the proof, the more irritating it is. And alcohol also increases gastric acid secretion, which can lead to additional damage. There is one alcohol that is, they're not home yet. They'll be home in a couple minutes, okay? Yes. Okay, we had kitty playtime just as I was supposed to talk about Everclear. Perfect timing. There is one bottle at the liquor store that says right on the label, do not consume on its own, and that is Everclear, which is pure grain corn ethanol. Um, it is 97% alcohol. It is an extremely high proof. Um, and it is just pure grain ethanol. When people drink things like that, they get a huge amount of inflammatory damage to the stomach. And when that's done chronically, that can lead to chronic gastritis. So we do see chronic gastritis because of drinking. There's also chronic gastritis as a result of H. pylori. And here's what H. pylori looks like. It's kind of like a little cheese puff with, or cheese doodle with tails associated with it. And H. pylori is fine as long as it doesn't gain access to the actual lining of the stomach. When you have strong mucosal barriers, the H. pylori can't penetrate it and it can't break down the mucosal barriers. But if it can, because that person is taking something that has broken down their natural defenses, then H. pylori can make little holes in their mucosa and then lead to gastritis, which increases the chances of gastric cancers. Um, so, gastritis, not great. What's more common, but definitely less enjoyable, is acute gastroenteritis. So it means a short term inflammation of the stomach, and entero is referring to the intestines. So inflammation of both the stomach and the intestines. So this is generally due to RNA viruses like the norovirus, rotavirus, astrovirus, and enterovirus. 90% of these are due to norovirus. Norovirus is something that spreads really easily. If one person in the house gets it, everybody's going to get it. That's what you hear about spreading on things like cruise ships. And the old micro professor, Dr. Shapiro, used to say when there is projectile vomiting and projectile diarrhea, that's norovirus. So it's coming out of both ends and it's coming out very violently. So that's norovirus. But acute gastroenteritis is one of these viruses entering the body, causing nausea, vomiting, abdominal cramps, profuse watery diarrhea, and it usually goes away on its own because these viruses live in the intestines and they cause an infection of vomiting and diarrhea that lasts for 24 or 48 hours. And once it's out of the body, well, then it can't cause symptoms anymore. So it limits its own length in the body by where it resides. That does mean, though, that it can pass to other people really easily. So we should take lots of hand washing and Lysol protocols to try to prevent that. What you see over here is a treatment algorithm. So you've got somebody coming in with gastroenteritis. Are they going to need to be included in this treatment, or no? Give them care. Are they vomiting without diarrhea? Maybe it's not acute gastroenteritis. Have they lost a lot of weight? So you look at whether or not that person needs to go on treatment, whether they need something else, oral rehydration, something of that nature. But you'll find a lot of these treatment algorithms to get you an idea of how to treat a patient when they come in with acute gastroenteritis. Then the kind of final gastroinflammatory disorder is gastrointestinal reflux, or GERD. Most people call this heartburn. It's a really straightforward disorder. So I mentioned that we've got this sphincter that leads to the stomach at the bottom of the stomach, or esophagus. It's called the lower esophageal sphincter. And it only is open to let the bolus go from the esophagus into the stomach. So it should be closed in most times, only when you're swallowing. In GERD, the lower esophageal sphincter doesn't close appropriately, so therefore this really low pH stomach acid has the chance to get up to the esophagus. The normal pH in the stomach is about 2. That's really low. 1.5 to 3, that's your normal pH range of the stomach. Remember, in the rest of the body, it's 7.4. Your stomach has a nice strong lining to protect itself against this acid. Nowhere else in the body has that. So if this really strong acid gets anywhere else, it's going to cause damage and inflammation. So GERD is describing the pain that results because of chronic reflux of acid because of the improper closure of the sphincter. So that's all it is, improper sphincter closure. It affects 1 in 10 people. Of those people, 20 to 44% experience weekly symptoms. And the likelihood that you'll experience GERD goes up with age because of the breakdown of connective tissue over time, pregnancy, and weight gain because of the abdominal obesity or abdominal fetus in some cases. That, if we drew a person with abdominal obesity or pregnancy, it doesn't matter. It says their belly button. The stomach is way up here. So if there was a fetus growing here, this looks like a bunny rabbit now, if I drew whiskers on it. Okay, anyways, sorry. Forget about the bunny. So if this is a fetus and the stomach is way up here, well, that's going to put a lot of pressure on the stomach and increase the likelihood of GERD. So symptoms, typical, that means what you would expect. Heartburn, regurgitation, belching, salivating a lot. Atypical means we should probably get you treated with something because that's not normal. So having asthmatic symptoms that aren't allergy related, having a cough, having a hoarse voice, inflammation of the pharynx, and having chest pain. That's why they call it heartburn, angina like chest pain. Sometimes people go to the hospital, think they're having a heart attack. Complications means what happens if you don't treat it appropriately. Chest pain, choking, difficulty swallowing, bleeding, and it's easy to treat. And if you don't treat it too, more complications are different pathologies that can result. So esophagitis is inflammation of the esophagus. Barrett's esophagus is a type of metaplasia where the esophagus lining changes into the lining of the stomach. That seems like the body's trying to help, but it's definitely not. It's bringing you closer to stomach cancer. And then there are different hernias that can result as well. So the first one is Barrett's esophagus. Again, if there's chronic GERD, the body will do things like try to help. And because of this constant inflammation and irritation that starts in esophagitis, there's a metaplasia of the esophageal lining to the lining of the stomach. So that now this can withstand the pH of the stomach contents, that 2, that 1.5 to 3. So this is metaplasia. Oh, it's written right up here, metaplasia. And this results from chronic esophagitis caused by GERD. So what's esophagitis? That's inflammation of the esophagus because of improper closure. So here's somebody, they look sad and sleepy. They have a yeast infection. That can cause some of these effects in the esophagus. Most of the time, though, it's anything that causes GERD. If you don't have proper closure, then you get inflammation of the esophagus. So all these things that cause GERD, they can lead to esophagitis if that GERD is untreated. Another thing that could be associated with this heartburn-like feeling, It's called a hiatal hernia. And the reason we call it that is this little place where the esophagus goes through the diaphragm is called the hiatus. Like, I'm taking a little hiatus, I'm taking a break. So the hiatus. So a hiatal hernia means something herniates through the hiatus. So first, we have one that's not associated with heartburn, but I'm just going to teach you about it because why not? Today's the day that we're learning about this stuff. So the stomach should be below the diaphragm, right? So in this case, here's the diaphragm, and here's part of the stomach. It's herniated out, and now it's lying in the chest cavity. This is where your heart and lungs should be. So here this lung's like, get away from me. And the heart's like, help me, lung. And the stomach's like, I want to go up there. It looks really cool, the mediastinum. So every time you lay down, and over time, if this isn't treated appropriately, this can get bigger and bigger and then impinge on the lungs and the heart. However, it's not going to increase like heartburn effects. What will is called a sliding hiatal hernia or hiatus hernia. This is when the stomach is essentially trapped in the hiatus. So every time you breathe, the diaphragm pulls down and then it goes back up again, right? That's how you breathe. So this means the stomach is going with it. Every time the diaphragm moves, the stomach gets squeezed up and down, which means some of that acid can get squeezed up to the esophagus too. So that will definitely lead to heartburn and the heart feeling really bad. It's not really the heart, it's the pain that's associated with inflammation of the esophagus. So untreated GERD can lead to these hiatal hernias or be a result of a hiatal hernia, lead to esophagitis, and which then leads to Barrett's esophagus. So we want to try to treat them before they get that bad. Other things that are similar, but don't get them confused to GERD, are ulcers. Peptic ulcers, the term peptic comes from the stomach acid pepsin, which is the acid that breaks down proteins. All of our organs are also proteins. So here is a gastric ulcer. We can tell the stomach because all these rugae, right? Here, this little hole, that's a bleeding ulcer. Oh, that's pretty bad. So that's an exposed vessel. So this whole thing, so here's a little ulcer. It looks pretty gross. So this is an exposed vessel. It means that there's so much breakdown. Now this is bleeding. So remember, this blood is, because it's bleeding inside of the stomach, that will go into the stool. Remember, digested blood is called tarry stool. It looks like tar. It's sticky, it's black, and it's a sign of digested blood. This is a small amount of digested blood, so that'll be hard to pick up unless you do something like a scope to check out this area or a fecal occult blood test. Here is the most common place to get an ulcer, the duodenum. This one is really, really big, large duodenal ulcer. And if either one of these burst open, you're like, here's a gastric ulcer. That blood and fluid's going to go out into the periphery. It's going to bleed. It's going to cause inflammation. And remember, all organs are high in tissue factor. So now there's damage to an organ. There's going to be the release of tissue factor, and we're going to activate the fibrinolytic cascade. So we're going to get scar tissue all around. So that pain is called peritonitis, but that scarring associated with it, that's really dangerous, and we'll see that in a bit. What causes ulcers? Just like GERD and other things, H. pylori is the most common, which we know is associated with a breakdown of the mucosal barrier. Another thing that can do that is NSAIDs. Also anything that increases the secretion of acid by the stomach, so gastric hypersecretion, that can happen because of certain foods, also because of cigarette smoking. Another thing about cigarette smoking is that it limits how well the pancreas can make bicarbonate. So not only do you have too much acid, you also have the pancreas not neutralizing stomach acid appropriately. So it's kind of like a double whammy. One fun thing is that stress can cause an ulcer, but spicy food cannot. They did studies where they took little seeds from hot peppers and used a scope to put them down in people's stomachs so that they could swallow them without like vomiting them up because they're too spicy. They found that there was no ulceration. So good for us. Different things that can be therapeutic. Ulcer therapy, anything that increases gastric acid secretion should be decreased. Dairy is one thing that really increases gastric acid secretion because the pH is so high. So we want to limit high pH foods like dairy, like ice cream, milk, yogurt, all those things have a really high pH. Also, acidic foods, those go into open ulcers and sting it and make it less likely to heal. Orange juice, coffee, tomato sauce, chocolate, fats. And then H. pylori is a bacteria, so it's not going to go away unless you also give an antibiotic. So if they're H. pylori positive, an antibiotic will help. Some antacids do help limit the growth of H. pylori. One of them is sodium bicarb, which you buy in the store as baking soda, Mylanta, Rolaids, Tums. Those can make you feel better in the short term, but one thing about them is they can cause rebound reflux, where the stomach makes more acid afterwards because it changes the pH of the stomach contents to a really high one. And then there's different medications. There's drugs that block the histamine receptors on parietal cells so they can't be signaled to make acid. And then there's proton pump inhibitors, which are the strongest ones. Those all end in prazole, P-R-A-Z-O-L-E, P-R-A-Z-O-L-E, like omeprazole. Those are really strong drugs that prevent pretty much all production of hydrochloric acid. So if there's no acid production, like hydrochloric acid, then you can have the ulcer heal. Because if you imagine pouring acid on an open sore on yourself all day, it's not going to get much better. So we want to neutralize that acid and let the stomach heal. Okay, finally, we just have stomach cancer, which unfortunately is a cancer that has a really poor prognosis because there's not a great screen for it. And the symptoms of stomach cancer are pretty vague. You just feel like an upper stomach upset. This is one of these things that, because the tumors get so big, you can see iron deficiency anemia in the case that the tumor outgrew its blood supply. So that's a really good sign, again, to keep in mind your anemia types. A family member of yours, if they have that, you could actually help discover theirs earlier. But otherwise, there's no really great screen. So by the time it's found, it's usually progressed quite a bit. So in this picture, we see this huge carcinoma. It doesn't resemble the rest of the stomach. Sometimes they do a full gastrectomy, and remove the whole stomach, or they can do a partial to remove a portion of it. That's really the treatment, is chemotherapy to limit the proliferation, removal of the area of the tumor, and then a second round of chemo and or radiation. And then the survival is really depending upon the stage of that tumor at the time. Unfortunately, is something that it's a little bit more advanced than other cancers when it is found. So overall, the prognosis isn't poor, but there are some newer experimental therapies that have been aimed at treating this more safely and more beneficially to the patient.